would you like to make a case? And when you come to the podium, please state your name.
We're here to settle a dispute over health insurance between the city and its employees that we believe did not need to happen. A time that requires seemingly never-ending rounds of discussion, tough decisions, and belt-tightening. What my members overwhelmingly told me over and over and over again was that it was patently unfair that most employees contribute to health insurance and that a special executive class of employees do not. With some of the most highly compensated city employees basically getting a free ride on the backs of all other city employees and the public, that this was unacceptable. They didn't like the plan, and they do not like that only some folks have to pay into it. Employees who are already enduring a wage freeze, and most of whom take 5 furlough days, which amounts to a 2% pay decrease under the city's health insurance plan, will have to pay additional premium costs for family coverage and more in co-pays and deductibles. This is difficult to stomach on its own. Employees must now pay more for name-brand prescription drugs, visiting a specialist, prenatal visits, and going to the hospital. The employees do recognize that the city has opened a clinic and commends the city for taking this step. This clinic is a good idea, but let's face it, it's not capable of meeting all healthcare needs. People are going to have to rely on their health insurance. Employees recognize that the city is enduring some lean years, and they've done and will continue to do their part, but again, they're not stupid. They also recognize when they're being had. As I mentioned, in December, the union presented to the city with an option to suspend the executive plan, which made fiscal sense for the city, saving over $100,000 to taxpayers and would have likely secured a ratification vote from our membership. But the city's negotiator rejected this proposal and declared impasse, effectively shutting down negotiations. The city and employees, as Ms. Panerites mentioned, have had to pay dearly to keep the old plan. There is some characterization. In 2010, 2011, the city did absorb the 8.55% health insurance increase demanded by the carrier. However, this is being characterized from the city as having gone just to the SEIU unit, when it was in fact distributed across the board to all general employees, represented and not. This is an important distinction. Regarding the city's health insurance plan in comparison to other municipal employers, yes, the city's plan is comparable, though getting worse. However, many of the municipalities the city compared with the plans to, such as Jupiter, Boynton Beach, in these cities, have city employees endured furloughs? No, not one. Not one furlough day. No other city compared has employees being furloughed. The city says that the executive plan is a recruiting tool. All indications are that executive-level city management is compensated fairly and paid as much or more than executives in cities of comparable size. Other public employers in South Florida remain competitive in attracting top talent to run their agencies. West Palm Beach remains a destination that employees want to relocate to and does not need special benefits in order to do so. The city argues that since executive-level management are not covered by a collective bargaining agreement and serve at the behest of elected officials, that they are therefore entitled to such benefits. This rings hollow. There are dozens, if not hundreds, of at-will city employees who are not covered by a union contract and can be fired without just cause. City administrators in other municipalities also serve at the behest of a commission or mayor and can also be terminated on the whims of elected officials. The city of Boca Raton can decide that it wants to go in a different direction and terminate their director of utilities without cause. The city of Boynton Beach can terminate their city manager without cause. There are hundreds of such employees in any city. These at-will employees, however, in these other cities don't receive additional benefits for being so. They contribute to their health insurance. This is an antiquated benefit that is no longer sustainable. No employers in South Florida, no public employers in South Florida offer this benefit other than the city of West Palm Beach. What is so special about executives and elected officials in the city of West Palm Beach? The city, when it wants concessions from the union, tells us in bargaining that the circumstances have changed and that certain benefits are just unsustainable. This is such a benefit. Commission, you can't be fired. You're elected officials. At a time when there's a constant attack on the image of the fat cat and public employee, what is more synonymous with that ideal than one employee receiving a better benefit than another? All of us are stewards of the public's trust and public resources. For a minute, imagine if the situation was reversed. If you had only union-represented employees receiving this benefit and unrepresented not receiving this benefit, you would be coming up to us and saying all workers needed to be treated the same. In that circumstances dictate cuts. The federal government acted to outlaw discriminatory practices in group health insurance plans just like this one, under Section 2716 of the Affordable Care Act. While we do not know whether any or all provisions of the Act will remain or be struck down, that comes out tomorrow, hopefully. As we sit here today, this is the law of the land. And not one of us in this room knows what is going to happen. This is the direction of leadership in this country is going against discrimination in healthcare plans. You know, the union knows that you can simply hide behind the special magistrate's ruling and keep the plan, or you can do the right thing. It's a question of morality and of leadership. Your vote today, your vote on your very own benefits that are different or special, better than other workers, that's a tough vote. A vote to keep this executive plan today is a vote to say that some employees are just more important than others. Also worth noting that the city of Jacksonville also has a strong merit system, and their executives do not have an executive health insurance plan. We do not negate the fact that this will, if we get rid of this plan, this will be a loss to those employees who would have to contribute to health insurance for the first time. But it's about fairness. We ask the City Commission that you set the example and be the leaders that we think you are, and do the right thing. City employees want to know that their department director, their city administrator, and their commissioners are right there with them in good times and in bad. Some people may want to say that there are haves and there are have-nots, but this is not set in stone. We here together determine that reality. The media and the public are watching you and wants to know what kind of leaders this city has. Will you lead? Which of you will step up and tell the residents and city employees that you truly understand their plight and that you will stand with them during this tough time? Which of you will tell the public that fair is fair and I will no longer accept this antiquated benefit? You'll vote on this today, but for those in the room who think that this issue is going away, you're wrong. This is an ongoing issue. You're dealing with a $6 million budget hole. This is important. The cities and the city employees are watching. We, the public, the taxpayers, city employees, demand that you stand up as leaders and lead and eliminate this special executive plan. Don't just pay lip service and tell us that you understand our pain. We ask that you act.
What questions do we have for Mr. Bryan?
I'd like to go back to, as the mayor said, and I think, I'll speak for myself. Yes, I think that we did in the last budget process start to have the conversation about compensation for everybody. But it is outside, and I don't think it's appropriate in this setting to have that conversation about what one group pays versus another. Not to say that we're not going to have that conversation, because I think we will, and I think we should. Are you suggesting that you have that purview to then assign any decision we make inside of the budget process to say that our decision for Parks and Rec should come under your scrutiny, and that we should be changing what we have allocated to that department to mitigate any increases in another department?
That the city wants to say, you know, the special magistrate did agree with you in that regard. So we're asking you to turn that on the other side of the foot. If you're saying that you've offered us a benefit that is good for the rest of Palm Beach County, just quite as good as the rest of the market, why would the city cling to a benefit which we know costs the city out of a very finite pool in favor of one group of employees over another? There was a comment regarding the clinic that the employees can go to get free health care and generic prescription drugs. We also believe that the commissioners and the top level executives can also get that from this special, this health insurance clinic, which we actually believe in. We strongly believe in. So we're asking, it's more of a moral imperative. And you don't even have to. No other municipal employer, public employer in the county, we can't seem to find one in the state of Florida that actually provides the same benefit for executives.
That's not your purview, Mr. Breyer. It's our purview to make a decision about that.
Absolutely.
It's not your purview to have it part of your bargaining rights. It's not related to your bargaining rights.
A different special magistrate might have ruled differently. I mean, obviously I can't, I'm not a lawyer, I'm not trying to pretend to be one.
Your right to argue for the benefits of the union. It is not your right for the union to argue with the benefits that we will or are going to consider at some other time, perhaps when we're talking budget. And I think what happens is the way that you're framing this and the way that the union is framing it, it villainizes the commission and the executive administrators because it sounds like we're not willing to give up anything. And that's not what's happening here. I think what we're actually saying is we're not willing to use that as a bargaining tool. And that means that when we sit down in 3 weeks from now at the same room talking our budget, that we don't say, okay, it's time for us to take the hit.
We offered to the city during negotiations a suspension of these benefits. We could, like I said before, we probably could have gotten ratification. I don't know that for a fact, but I would presumably, in my opinion, I would have assumed so. The employees tell me this. I get calls weekly about this. And it's not that they don't, it's not even the 4.1% increase to health insurance that they're paying. In fact, the union recognizes that health insurance costs are skyrocketing and that employers, municipal employers especially, are strapped to deal with it. And we're willing to take our hits, and our people have even told me this. But overwhelmingly they tell us that it is not fair and we want to do something about it.
And I'm giving you my own personal commitment that we are going to continue to push this envelope so that that everybody in the city is contributing to the total solution. This is not just about one group versus another group. There's total man and